Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. There are many reasons why the United States and many other Western countries are in big trouble. America certainly isn't the same country I moved to a few years ago. It's quite tragic what's happened over the last few years. And it's important that people outside the United States get a true perspective of what's going on here. Let me share with you this clip from the Assistant Secretary of Health for the United States, Rachel Levine. That wasn't always the name, but let's not go there. Let me share this with you here.
I'm Admiral Rachel Levine. This Black History Month, I'm pleased to partner with OMH in advancing better health through better understanding for Black communities. Climate change is having a disproportionate effect on the physical and mental health of Black communities. Black Americans are more likely than white Americans to live in areas and housing that increase their susceptibility to climate-related health issues. And 65% of Black Americans report feeling anxious about climate change's impact. Through our Office of Climate Change and Health Equity and the Office of Environmental Justice, we're working with providers and community leaders to identify innovative approaches that empower communities to address the health consequences linked to climate change. Visit hhs.gov for more information.
So there you go then, a statement from the Assistant Secretary of Health for the United States right there. And I don't know about you, but to me, that doesn't look like a great role model of health and well-being. But anyway, regardless of that, the statement itself, imagine focusing on climate change and not mentioning in that statement or any other recent statement the true problems facing one of the poorest and most vulnerable communities in America. Why not talk about the explosion of chronic diseases, type 2 diabetes, heart disease, obesity, liver disease? No mention of that whatsoever. Or what about the real root causes of the problems with regards to chronic diseases? The fact that within the last 20 to 30 years, these communities have been flooded with cheap, ultra-processed, addictive foods, foods that lack in basic nutrition and result in a lot of different diseases. People in poor communities have no choice but to be consuming these horrible foods. And food companies, food corporations get very rich indeed. And then Big Pharma gets very rich when people get sick. So why not make a statement about how the goal should be to get real wholesome food to these communities, which is affordable, and also to promote education programs so that some of the most vulnerable, least educated people know what they should be eating. And then there's the fact that healthcare is ridiculously expensive in the United States. If you have healthcare which is unaffordable, obviously the poorest people can't afford healthcare, even basic care. But no mention of those things at all. Let's focus on climate change and let's make that the focus of our statement. And it's so important that people outside the United States get a perspective of what our medical leadership is currently like and why we have little hope whatsoever of things truly improving. So I have nothing else to add to that level of idiocy. I'm speechless, but I will leave you with a statement from Zuby, the great music artist, in response to watching that video. Why do you need satire when you have reality?